Hey, good morning, everyone, and welcome to the show. I'm your host, Vic Sinise. Glad to see everybody here. If you're watching us live, great. Glad to see you. We're on all those different places you see there. If you're watching us on YouTube, be sure to hit that subscribe button or like button. This is your first time joining us, be sure to check out our website at UroNurse.com, the best place to go to catch us up on all of our great things, including all of our past episodes. Up to 90 episodes. Wow, lots of stuff to choose from. Hey, want to listen to us in your car? No problem. Just go ahead and check out our UroNurse Plus area where you can find our audio podcast on any of your favorite podcasting systems. And if you're a patient watching this, why don't you check out our europatient.com page? It's available every Saturday at 10:30 a.m. Central Time. Follows this show. We always got a great show for you. If you're not getting our newsletter, what are you waiting for? Just go ahead and go to our website and sign up on our website, and you'll start getting our newsletter every Monday morning. And it's all done through MailChimp, so nobody sees your email. This week, we're joined by Anthony Lutz, who's the president of the CBUNA, the certification board for the CUNA organization. And we're going to talk about how we can get all of you certified. So let's go ahead and bring in our experts right now. Experts, welcome to the show. Hey, everybody. How you doing?
Morning.
Good morning.
So as I said, my name is Vic Sinise. I'm the host, producer, and I've been involved in urology, for those of you who may be new to the show, for the past 40 years. And this is my way of kind of giving back to the profession I've enjoyed so much through all these years. So bringing these great informational shows to you. If you have any questions, go ahead and use the comment box. If you're watching us live, I can see a number of people are watching us live, and feel free to put comments or questions in at any time, and we'll take those later. Let's go ahead and have Lori introduce herself.
Good morning, everyone. My name is Lori Atkinson. I'm a certified urology registered nurse. I have been in urology for 25 years and currently work for a urology practice in Geneva and Winfield, Illinois. And I can tell you, certification is key.
Yep, absolutely. All righty. And now let's bring Anthony in. Go ahead, give your introduction, and then we'll bring up your show.
Sure. Well, thanks for having me. I'm Anthony Lutz. I'm a certified urology nurse practitioner. I'm the president right now of CBUNA, which is the certification board for urologic nurses and associates. And I'm a nurse practitioner at a urology practice called Atlantic Medical Group in Summit, New Jersey right now. I grew up in Minnesota, but I'm on the East Coast now, and I've worked in urology mainly in New York City and now in New Jersey for the last almost decade. So thanks for having me.
Oh, great. Glad to have you on board. And let's go ahead and take you over to your slides and take it away.
Thank you. So this is CBUNA. So basically the certification board for urologic nurses and associates. And just to talk today about what we do, who we are, and talk a bit about certification and why it's so important and why we really believe in it as board members on the board. Just to start in general, though, what is certification in general? And it's an agency or association that's validating an individual's qualifications and knowledge of practice in a defined clinical area. There are standards that are created, and this group is saying you are a subject matter expert in this specialty or this field. It assures both other professionals that you work with and the lay public, the patients that we see, that this individual has the knowledge needed to be an expert in that role, to be taking care of patients with a very strong knowledge base and to provide excellent care. And this goes far beyond urology. There are specialty certifications for all different specialties in nursing. And so we feel really strongly that as practitioners in urology who love urology and want to take good care of patients, that this is a really key part of that process. Some of the purposes of certification just in general: develop standards of nursing care that are vital to the public interest. That standard can be made and that good quality care can be defined. It also provides growth and advancement opportunities in nursing practice, whether it's in urology or in other specialties. Advancing as a practitioner individual achievement in your sense of professionalism, and promoting a commitment to quality in the care that we deliver to all of the patients that we see. And this goes for all specialties in any type of certification, whether you're certifying as a critical care registered nurse, as a nurse practitioner, any specialty. But who are we at CBUNA? So we at CBUNA, it's the only national certification body that's established to certify urologic nurses and associated healthcare professionals in urologic practice. We were established in 1972, so just a couple of years ago, we celebrated our 50th anniversary. And we were established to develop and implement certification exams for urologic healthcare professionals. We're a separately incorporated independent organization. We collaborate with CNET, which is the Center for Nursing Education and Teaching, in terms of how we actually have the tests performed. CNET is a company that helps to make sure the tests happen, that you're able to take your test, that you get your score. And then we help by creating the test, writing test questions, and working with them to make sure that those questions are validated, accurate, and a good measure of true current clinical practice. We also work collaboratively with SUNA, the Society for Urologic Nurses and Associates, and all of our certification exams are endorsed by SUNA. So we're a separate organization, but we collaborate really closely with both of these organizations to provide the best possible certification exams that we can. On the board, we're comprised of board members who are all certified urologic nurses or associates with current experience and expertise in urologic healthcare. And there's one public member also that doesn't work in the field, that looks out for basically advocates for the general public from a non-clinical urologic perspective. So we're all urology nurses, nurse practitioners, or associates who are volunteers on the board to help really advance the cause for certification and help write good test questions. We kind of try, if we can, to have members from different parts of the country and who work in slightly different subspecialties in urology, if possible, to kind of help to get a nice broad background of experience for who's writing the questions and validating them. So it also becomes a nice way to, if anyone's interested in volunteering, getting involved in anything, it's a great way to meet other professionals from across the country and really work to try and advance the cause of certification. This is our mission on CBUNA. That's to improve the quality of care provided to urology patients by promoting and acknowledging the highest standards of urologic nursing practice through the certification process. And there's a couple philosophies, just for a little bit of background, that kind of fulfill that. We believe that individuals, families, communities seeking urologic healthcare, they expect and they deserve a standard of excellence in the care that we provide. That excellence may be enhanced by certification of those professionals that are entrusted to deliver that care. And certification should be awarded following successful completion of a comprehensive examination that assesses a broad scope of knowledge applicable to urologic care. And why certify? Why does this matter? I think is a question that we get a lot and is a good one. And Suzanne Qualich wrote an excellent article in the Urogram a little while ago that outlined some key points to, I think, why it's so important. We always like to refer back to this. It's kind of a great summary of kind of like the top 10 reasons why we consider certification so important. Not only does it improve your skills and your knowledge base, because as you're studying for a certification exam, you may be learning or familiarizing yourself with parts of urology that maybe you don't see on a day-to-day basis, but it's important to know as part of your knowledge base. So you're kind of getting the opportunity through certification to also expand and stay up to date on current practices in all sorts of different subspecialties of urology. Certification, it can improve career opportunities and advancement. So it shows that you're really willing to invest in your career. It shows that you've demonstrated a mastery of the practice of urologic nursing care. And that, I think, can be a very positive thing when either looking for jobs or looking for advancement in your current job, whether it's into leadership or other roles. Can it potentially result in increased economic advantages? There are some facilities that offer bonuses or hourly differentials for certified individuals. Certification can also serve as a point for negotiation. If you're negotiating for a new role, a new salary, a new hourly differential, this can be a key point to say, hey, I'm a valued, experienced expert in the field. I deserve to have that's shown in how I'm compensated. This isn't the case everywhere, unfortunately, but we really believe on the board, the more that we advocate for this specific point, the more that it happens, the more that it really benefits everyone and hopefully becomes a more commonplace practice. I've heard just from talking to certified members, there are certain facilities that are better about this than others. I've heard the VA does a great job of any certification you have goes into your calculation for pay. There are some other facilities that do it as well. But we really want to keep advancing this because we believe that people deserve it. You work hard, you become a master of taking care of urologic patients, and that should be influenced and impacted in how you're compensated. Demonstrates commitment to the care of your patients, and certification enhances the overall professional image of the role. The more that we show that we are subject matter experts, that gives us a lot of viability with not only the patients that we take care of, our fellow counterparts and coworkers, students who come to learn maybe from you. It shows that you are an expert in what you're teaching and showing them. The other 5, to kind of just break them up, certification reflects an achievement, both professional and personal. We are a third party. That's basically saying, hey, you took this test, you showed that from an outside perspective, we believe that you have shown that you really understand these concepts for urologic care. And I think that reflects, in building self-esteem, that really reflects in your ability to kind of also tell yourself, as we all every day work so hard to take care of patients, that I've really stayed up to date on current care practices and know what I'm doing and can do the best job possible. May lead to greater on-the-job responsibilities. Also, this could lead towards advancement, maybe in leadership roles, as you show that you've dedicated your time to being an expert in the field. It allows peers to recognize you as an expert and contributes to professional credibility. So I think all great points to really kind of show why certification is such an important thing and why we believe it's so important on the board, why we joined the board to work on this and to try and make the exams as accurate and up to date as best as possible. These are our 3 certifications currently that can be achieved. The CURN, which is a Certified Urologic Registered Nurse, CUNP, Certified Urologic Nurse Practitioner, and a CUA, which is a Certified Urologic Associate. The CUA encompasses a wider range of who could be available to take that exam. Most predominantly, we see LPNs, LVNs, and medical assistants who maybe apply for taking the CUA exam. This could also include occupational therapists, physical therapists who are working with urologic patients, and many other people in the kind of allied field of urologic care that might just not fall under CURN or CUNP. This is our badge also, just to put in a little plug for it. For Certified Nursing Day, we created this online badge that you can put on your email, you can put on your social media. It's available on our website, and there is also a little pin you could get also, but that's what that looks like if you see anyone who puts this on any of their social media. Just to talk a little bit about each of the exams, the CRN exam is accredited by the ABSNC, so that's the Accreditation Board for Specialty Nursing Certification. We're very proud that really within the last decade or so, we've achieved ABSNC accreditation for both our CURN and CUNP exam. The ABSNC is the preeminent accrediting organization for all specialty nursing and nursing associated credentialing programs. This is the body that says the critical care registered nurse certification is accurate, is appropriate, is accredited. They're saying your nurse practitioner national certification the same way may be accredited. So we are really proud to have achieved that and maintain that, which involves them also evaluating how we create the tests, how we validate them to make sure we're doing it in the appropriate and most accurate way. The CRN exam in itself, it's a computer-based exam now. There's 150 questions that cover many different areas of urology. The test used to be historically a paper and pencil test, which many people might remember if you went to a CUNA conference, maybe there would be a day where you sit down and take a paper and pencil exam, or a half a day. We, over the last several years, transitioned to solely computer-based testing that's done at computer testing centers throughout the country. We found that this really makes it much more accessible to do. You're not having to wait once or twice a year for maybe a conference to do it in person. You can do it much closer to you, as there are computer-based facilities throughout the country. And really, ever since we transitioned to computer-based testing, and really since the start of the COVID pandemic, we've opened up the availability to take these tests all throughout the year. So you're not having to wait for once or twice a year. We want to make it as accessible as possible to wherever you are, whichever time of year becomes the most convenient for you, that allows you to prepare and take the test when you're able to. It currently is still being offered in computer-based testing centers throughout the country, throughout the year. Also on our website, on the board, we're always very careful to not talk about topics on the exam. That's always something kind of important to us. But on our website especially, and if you get any of the prep books, there is a pretty clear axis for the general topics of the exam and how much of each of that topic is incorporated. So, for example, here is the percentage of maybe questions in a benign prostate section, or an avoiding dysfunction section, in a stone section. And here's maybe a very, very small percentage of pediatric urology questions, to kind of really help in terms of where do you put your time into preparing and how do you best prepare. So you kind of have an idea of maybe what general concepts are on the exam to help you prepare, without saying here's exactly what's on it. So that's all available on the website as well, which I find very helpful for a preparation point. The passing score is determined by something called the Angoff procedure that we as a board do once every 5 years or so, where we go through all the questions on the exam and help to make sure that they're validated, that they're current, they're appropriate, that we're testing what people are actually doing in practice. So if you see emails come out about, oh, here is CBUNA asking, what do you do in your role right now? Those are so vital to us to really say, what are people actually doing in the certified urology RN space throughout the country? Because as we know, maybe what happens, what general day-to-day clinical practice happens in one part of the country may be very different than another. And we want to be able to really gauge, how do we best find what is the current general most well-known practice for someone who is potentially about 2 years into practice? What should you be doing? What should you know at that point? And that process really helps us. So if you see those emails come out to do any of those surveys, we really appreciate it. When you do those, it really helps us make sure the test is as up to date as possible. The current passing score is set at 70%, and that gets adjusted slightly each time we do a new updated Angoff. Not only does it say what are people actually doing, but based on the difficulty of the test questions, what would be the accurate, appropriate passing score. So we're setting that and updating that constantly as we go and as we do these procedures. Just some eligibility criteria here. I say US because there are some international eligibility criteria as well. Those are also on our website. But for a US eligibility, you must have completed a nationally accredited nursing educational program. You must have completed 2 years of working as a registered nurse with a minimum of 800 clinical practice hours to urologic patients, sometime within the last 3 years. That just means we want to, when we are assessing the knowledge base, the level for these exams, we're basically asking, what does someone who has been a nurse in urology for about 2 years, what should they know? What should they be doing? And is that appropriate and current to what's going on right now? The applicant must hold a current unrestricted professional license in the US, of course. That's usually a pretty commonly used eligibility criteria. It can be a little tricky, I think, sometimes to see that you must be 2 years working as a nurse, minimum of 800 clinical practice hours to urology patients within the last 3 years. Obviously 2 and 3, those aren't the same number, but if you maybe transition from a different role, or if you're not working solely in urology, but working in a general practice that sees a lot of urology patients, so you have a lot of urology practice hours over a period of a couple of years, that can also apply, because we know not everyone who takes care of urology patients is solely doing an only urology practice. So we want to make it as open to as many people as possible with that level of experience. The CUNP exam, some of this is a little bit similar to the CURN in that this is also accredited by the ABSNC. We just at the end of last year renewed that accreditation for the CUNP exam, which is a big undertaking for us as a board. So we're very excited by that. This year we will be doing the renewal for the CURN exam as well. So the CUNP computer-based exam, 175 questions for this one, also covering many areas of urology. The current passing score for the CUNP exam is 72%, and then the eligibility criteria is listed here. Similarly, must have completed an NP program that's nationally accredited, must have completed 2 years of working as an NP with a minimum of 800 clinical practice hours for urology patients within the last 3 years. You must have your current record. You must be recognized by your state board as an NP. You must have either a master's level or a DNP. And you must hold current national certification from one of the national certifying bodies, whether that's the ANCC, the AANP, PNCB, any of those. The associate exams, the CUA exam, computer-based with 150 questions. This is not ABSNC certified for the sole purpose of this may include people who aren't specifically nurses. So if this includes medical assistants, we can't really apply for a national nursing certificate, a national nursing accreditation program. But we still put a lot of care into making sure that these questions are updated and accurate as well, and would kind of encompass what we think multiple roles of people, whether you're an LPN and LVN and a medical assistant, what they may be encompassing on a day-to-day basis. The current passing score there is also set at 72% based on the ANGOF. And the eligibility criteria is listed here. If an LPN or an LVN must have a current license and must have at least 1 year of experience in nursing practice as an LPN or LVN. The ABSNC certification is pretty, or accreditation is pretty strict about either RN or NP, which is why that's for those two exams. And that's why LPN and LVN fall under the CUA exam. If there were questions about why is that here and not elsewhere. For other associates, think medical assistant, occupational therapist, physical therapist, anyone else who's really working in a clinical setting, they must have completed an accredited training program with 1 year of experience in the field of urology, or they must have completed 3 years of in-service training under the supervision of a practicing urologist or NP within a letter of verification. So if you didn't take an accredited training program, but you're working as, for example, a medical assistant in urology, if you've been doing that for 3 years, you've been working under a practicing urologist or NP, they can write a letter and say, hey, you have this valid, excellent experience. You should be able to sit for this exam. All of these certifications, all three of the ones that we have currently, are valid for 3 years. Certification renewal is available by submitting either a minimum of 36 urologic specific continuing education contact hours or by retaking the exam. As you can imagine, most people do the contact hours. Occasionally, there is usually at least one person each year who does retake the exam, but most people will submit these urologic specific continuing education contact hours. We find really collaborating with CUNA to be so helpful for this, because if you're going to a CUNA conference, if you're doing the monthly CUNA free continuing contact hours, you will get these contact hours over a 3-year period. And the hours for renewal must have been earned in the last 3 years. It must be specific to urology. The year that your certification expires, they all expire at the end of the year on December 31st. How do you prepare for the exam? We get this question a lot. We do have exam guides that are prep guides that you can purchase through the website that you can use to help prepare. This includes information on the axis of what topics are on the test and how much of each. There are some practice questions and kind of helps also with understanding how to take the exam. There's also on the website a list of recommended reading. So there are some textbooks or books that we would recommend that could be helpful reading tools as you prepare for the exam. And so we kind of recommend using a lot of those together. Sometimes CUNA will put on a kind of general urology review course, which can be a very helpful tool as well, because that goes through a lot of different parts of general urology practice. We don't technically participate in that because we have to make sure that we keep our knowledge of the exam questions separate from any like exam courses, for example, but that can be a helpful resource. These prep guides can be a helpful resource. The reading list on the website can be a very helpful resource as well. This just to put in about the fees, because this obviously is an important thing as we think of any time of year, whether there's inflation or not, cost of things can be important. We do for all of the exams, there is a discount for CUNA members versus non-CUNA members. There are also retake fees. So if you take the exam and you don't pass it, you have 12 months to retake it if you would like at a discounted lower cost. So those are listed here. We encourage wherever you're working. Some people may have stipends for testing like this to be reimbursed by your facility. Even if you don't, we always recommend talking to your employer, your facility, to say, if you're interested in certification, it's a key important thing. We always encourage for places of employment, if that's in their possibility to do, to help to reimburse for costs for the examination fees as well. And there are options for group discounted rates if multiple people at a practice want to take an exam at around the same time. And for that, you would just directly contact the CBUNA board or kind of our managing organization through the website. Recertification fees are listed here. Again, discounted rates for CUNA members versus non-members. Please apply for these scholarships. We want lots of people to apply. We want to be able to give out these scholarships. We want as many people to be able to take the certification exam and recertify as possible. And we don't want cost to be a barrier if at all possible. To talk about a couple of the scholarships, the CUNA Foundation has the Jan Labutin CBUNA Certification Scholarship, where the recipient of this scholarship receives a stipend to cover the cost of the certification exam and the cost of a copy of an exam preparation guide. Each of these scholarships are given out once a year, so please apply for them. Also, the person who attains the highest score on the certification exam in the prior year is given the McFarland Award. If you've ever seen that at any of the CUNA conferences, they're given an award at the time of the conference that kind of recognizes that you achieved of this past year the highest score on any of the certification exams, which is a huge, huge accomplishment. The Jan Labutin scholarship is for your initial certification exam. And then we have 2 recertification scholarships to cover the cost of those. The CUNA Foundation graciously has a one-time reimbursement of the recertification fees. So it's the CUNA Foundation Recertification Scholarship. The documentation to apply for that received by December 1. And CBUNA has the Margaret Baron Gott Recertification Scholarship, which also provides reimbursement of the recertification fee for that applicant. And again, the documentation for the application due by December 1. All of the information for eligibility, what you would need in order to apply for these is all on our website. Sometimes people, I think, are concerned about if a lot of people apply, will I get these? There are some years that if we don't even have enough applicants, we aren't able to give out scholarships. So we want to give them out. Please apply for these. We want to make sure that everyone can not have cost be the barrier to getting certified and showing their dedication to their practice in urology. And it kind of brings us back to the why. Certification, it's a tangible recognition of your professional achievement and your special competence in the practice of urologic care by nurses, nurse practitioners, associates. It's a tangible thing that says, you have really dedicated your life to your work. You care about the patient care that you provide, and you want to make sure that you're showing that you're doing the most up-to-date, evidence-based, appropriate, and excellent care possible. We know that you're all doing it. We just want to have a way that you can also tangibly show that. And, you know, as also practicing nurse practitioners and nurses and on the board, we volunteer to do this because we really care about it, and we want to make sure that as many people can get certified as possible that want to. And if there's ever, this kind of leads to the next, if there's questions, please reach out to us. This is the website. So we recently, if you saw an email about it, we recently redesigned our website. So now it falls under the umbrella of the CBUNA website, but it also allows for us to kind of really maintain our close collaboration with CBUNA while still being a separate organization, and really has helped us to update a lot of the information on the website. If you saw the old one, there's a lot more updated new information here, including how many people are taking the exam, how many people are passing it, what are the axes of information that we need to help to study. All of the information on cost and scholarships are on there. And you can always reach out to us, whether it's emailing. The email here, AJJ is the management company that helps us as volunteers to help to actually put all this together. So if you've ever emailed CBUNA@ajj.com, hopefully you've gotten, they really work hard to provide quick and helpful answers as best as possible. And we work to make sure that, you know, as fellow, you know, clinical providers who, you know, during the week we're going to work, we're seeing patients, we want to help make sure that everyone can get certified and really show the great work that they're doing throughout the country. Or the phone number here could also reach the national office at AJJ if there's questions. But please look at our website. Please apply for the scholarships. And we would just encourage everyone to show, you know, we know what great care you're giving, and here's a really tangible way to show that.
Hey, that was really great, Anthony. Appreciate your information. I thought we have kind of a unique situation. All of us here have gone through the process of being certified. So I thought, why don't we share our own stories of what was involved? I'll be glad to kick mine off because I had kind of an interesting story. So I got certified years and years and years ago when it was a paper test. And then the first time I had to recertify, back in the day, you had the option of taking the test or doing some kind of a project that you had to put together.
Oh, interesting.
Now, the once I said the word project, I'm like, I'm out. I'm not doing a project. It seems like way too much work. I'll just take the test again. So I actually passed it twice.
Wow. You're the one person a year who does the test for recertification. Congratulations. That's great.
Now it's much easier with just doing the contact hours. So I just do that from now to renew it. But I would share it that it's easy enough to pass not only once, but twice or multiple times. Definitely want to say that being certified was a big plus for my career. I could tell you that as just a short story. One of the docs in my office, every time he'd introduce me, he'd say, "Oh, this is my nurse, Mr. Sinise. He's certified just like I am. He's the expert in this." So it was always like his brag. He bragged about it more than I ever did. So I think that it's great to get that recognition, especially when it's recognized by other people besides, you know, yourself. Yeah. So Lori, go ahead. You've just gotten certified recently, right?
Oh no, I've been certified.
Geez,
I think it was like 2001 or something. It's been a long time.
Oh yeah, a long time ago.
So hey, I had to do paper and pencil too, Vic.
Yeah. Okay. So all right. Go ahead.
I have a couple of things to share. How, you know, being certified. Actually, a few things to share that being certified benefited me. I mean, not only do you feel like you get that CURN, you know, after your name, and you're just so proud of it, but you're also, when you're dealing with patients and they know that you're certified, that you're specialized in this, they feel so much more comfortable. Recently, a few years ago, I had started a new position, and in my position, they required a bachelor's degree. And I don't have a bachelor's. I got an associate's back in 98. So they're like, "Oh, you're going to have to go back to school, complete your bachelor's." I'm like, "Oh my gosh, at this age of my life, I mean, geez, it's, you know, money and, you know." I got grandfathered in because of experience and because I was certified. They also, because I am certified, they also allow me and pay for me to go to conferences, you
Mhm.
know, because I'm certified. If I wasn't certified, they wouldn't allow me to go.
Mhm.
So there's so many, it just my position that I'm in right now. I believe it's experience, but that certification, like I said in the beginning, is key.
Yeah, absolutely. That's a great story. Great reason to be certified.
Yeah, and you know what? To be quite honest with you, it looks like a lot of contact hours because I know for RNs, we have to have contact hours 20 in 2 years.
Yeah.
For SUNA or Sabuna, it's the 36.
Mhm.
But realistically, 20 of those 36 urology credits you can use for your RN. They can be the same ones.
Yeah.
And then also, it sounds like a lot, but even if you become a SUNA member, they put out where you can get a continuing education credit once a month
Mhm.
for 3 years. For 3 years, that's 36 right there. You
Very
go
smart.
to a couple conferences, some of our conferences are what, 14, 15
Mhm.
credits. I
Mhm.
mean, it's not hard to do.
Yeah,
So I just want to throw
for
that in
sure.
there.
Oh, no, and that's a great point. Really, the goal with collaborating with SUNA is, as a SUNA member, not only do you get discounts on the exam on recertification, even if you can't go to conferences, if you did the once a month free contact hour through SUNA for 3 years, that's 36 hours. That's all you need to recertify.
Mhm.
So even if you're not able to go to conferences, you can still get those contact hours there. But yeah, from a conference, I mean, you get most of them right there. You can use them towards other certifications that you do, whether it's maintaining your RN or your NP. We try and make it as accessible as possible. We've changed that over the years to try and make sure you're not doing a project. You're able to kind of continue to recertify without it being kind of a burden on the regular working that you're doing. You've shown your expertise. We want you to be able to continue that. I also did the paper and pencil exam when I took it. It was at a conference. I remember I took the morning, I took the review course, and then I took the next day while the conference is going on, and you're in the room taking it. There is, I really was interested to do the paper and pencil because I hadn't done really like a Scantron test in a while. But I'm glad that now it can be so accessible. Like you don't have to go to a conference to do it. Wherever you're at, there's a whole list through. If you go to the website, it connects you to the CNET website that lists all of the computer-based testing organizations where they do other tests besides just ours. So that you can do them in all of the states throughout the country to try and make it as easy as possible to do.
Yeah, I've been trying to advocate. So urology in our region right now, um, they haven't had urology in this region, so they're kind of unfamiliar with SUNA. They're unfamiliar to an extent with certification. And so I'm trying to advocate for, we have a lot of medical assistants. We have, and they're coming up on 2-3 years of experience. And right now, unfortunately, they're not, giving any stipend or anything for, becoming certified. But I'm trying to be an advocate for that and changing that because, I mean, I think that it's just great for our providers to be able to know, or our patients to know, that our staff is, well educated and certified in this area.
Oh, for sure. And we really believe too, that's what it takes is a lot of local advocacy where you're at, where it still is, even in big centers. I worked in New York City for a long time before we moved to the burbs in Jersey. Even doctors there, administrators there didn't know about SUNA, didn't know about certification for us as the nursing providers also. So it's advocating where you're at so that it becomes more well known and that more people can then benefit. It should be something that's reimbursed because it benefits not only the doctor you're working with, the team you're working with, but the practice and the patient care. And kind of like Vic said, the number of times that I've actually been surprised, the number of times that the doctors I've worked with have been like, oh yeah, this is Anthony. He's a certified urology nurse practitioner. And then it kind of really changes a little bit the dynamic with the patient as a way to really show like, hey, I have experience. I can really take care of you in a way that you can feel comfortable. And I think it helps them feel comfortable and just contributes to good care overall. And it kind of feels good. The first time I heard that, I was like, oh, I was a little bit taken aback, but it does help, I think, too, in building like my own confidence and knowing that like, hey, I work really hard and I'm doing a good job. And we want everyone to feel that way for sure.
Yeah,
For
and
those of
a
you that are,
common
excuse me, one second. For those that are watching, if you want to share any of your stories, go ahead and put those on. I think Fran did
yeah.
share a story of her own up here. She took paper tests well, actually, she took her paper tests in 87 and 89. So thanks.
Wow, that's amazing.
Yeah.
That's awesome.
Maybe I might have sat in one of those paper tests with Fran. I don't, I
Right.
can't remember back then, but it
Right.
was a while ago.
Right.
One question I have for you, Anthony, is you'd mentioned there's a group discount. So how big of a group do you need to get a discount?
Oh,
And
yeah.
is there a definition of group? Here's my thought as I'm hearing this. Chicago Metro chapter, which I'm part of, has done in the past a chapter, review for certification where we just kind of went through different subjects to kind of get people ready. And I thought if we could get a group of people interested, how big of a group will we need? Could it be a group of Chicago Metro members and get a discount, try to get a bunch of us certified?
Absolutely. It's a newer program that we're still currently rolling out. So we don't have the quite parameters to say it has to be X number of people. Does it have to be 10 people? Doesn't have to be 20 people. It could be a smaller group even. But the goal being that you would be doing it kind of together, taking the test around the same time. So we're still kind of really working with trying to make it something that is a bit flexible so that if there is a slightly smaller group in a area where maybe there's not so many people, or if there's a larger group in an area where there is a more concentrated number of people, that we can still accommodate both of those groups. So if you have a group of people, whether it's 5, whether it's 10, reach out to us through the website directly to kind of the managing group, and we'll work to make something happen because we really want to make sure it's possible for everybody.
Yeah, that's great. And I think there's a lot of chapters might want to run with that same idea. Let's make a chapter effort at getting people certified.
100%. We would love that. And we'd want to do anything that we could as a board to help make that possible.
Good.
The one thing I guess I forgot to mention, you might see in looking at the information on the website, there are a couple older certification exams that have been sunsetted in the past that there is the possibility to still renew them. Because one of the questions we get asked a lot too, especially as an NP, is, well, what about PAs? The ABSNC, since it's a nursing accreditation board, kind of says that, hey, for us to accredit this, it has to be nursing related. But we do really try to collaborate with our other counterparts, like PA counterparts as well, if possible. It's just that's not part of the exam as it currently states. In the past, there used to be actually a CUPA exam and a CUCNS exam.
Yeah, I remember
those have kind of they've been sunsetted just because the volume at the time years ago ended up being relatively low. But there are still some people who carry those. They renew them because we also recognize that went a lot of work into doing that certification at that time. And we want to continue to acknowledge that, even though that exam maybe you couldn't take it today. But if you were to see a CUPA or CUCNS, those are still excellent certifications that are being renewed. And there is even if you're, you've done your time in urology, you're retiring from nursing practice, there is also a retired version that you can still move into if you would like. And so all of that's on the website as well, just to kind of mention those things too.
Yeah, great. Lori, we have a few people with comments.
We do. So Heather says, I earned my CUA years ago, but now I'm an RN. What will the difference be on the test? Any specific recommendations?
Mm-hmm. Yeah, with going from one level to another, think the difference in practice. So we recognize too that within scope of practice, there are going to be different things that we test an NP on, then we test an RN on, then we test an associate who we're kind of assuming what's 1 or 2 years of working as an LPN, an LVN, or an MA. So think of what you're doing now currently as an RN, what other RNs are doing throughout the country, and what's within that scope of practice in urology. And that will kind of help to say, how do the specific things we test on change? In urology, a lot of the general topics may be familiar. in terms of, if we're testing as someone on voiding dysfunction, well, we'll test a CUA on voiding dysfunction, a CURN on voiding dysfunction, and a CUNP on voiding dysfunction. But what's different about each of those roles and what we would expect from a knowledge base will be a little bit different. I think the probably most helpful place to start is the prep guides, because they'll be able to kind of give some examples of prep questions to kind of give you an idea of, okay, here's the level of things that we're looking for, and here's the types of topics. If we're going to ask about medications, well, what would we expect an associate to know versus an RN to know versus an NP to know? And that will change a little bit with the progression of the role. But I think to start with the prep guides is great. I think one thing that can be helpful is the core curriculum from CBUNA. They kind of have a nice way of, when they talk about a topic, they say, here's kind of what we would expect, and for the RN to know, for the NP to know, for the associate to know. So they kind of help to show also a bit of a guideline of what would be expected in the role. And we want to test things that are as consistent with what's being taught as possible.
Great.
All right. Barbara Rhodes said exam prep guide latest update. I have 2018 for the RN. What review course is offered?
The prep guide that you probably have is probably still the most updated one, because we're updating all of them currently. So pretty soon in the next, I would say, year or two, you'll see new updates for the prep guides. The goal with those is the way that we define the topics is going to be consistent. So it still is a helpful prep guide. There's still practice questions that are helpful, even though we update the information to meet current standards of practice. But those will be updated in the next year or two. That's on the docket. Those are being worked on right now. Review courses, we can't technically be a part of as CBUNA, because we have to make sure we maintain the confidentiality of the exam questions. But the group at CBUNA who offers those exam courses, those what we call kind of general urology review courses, even though we're not involved with those, they can be a great describer and teaching point for all the different kind of subspecialties. So I don't know if that's being planned as of yet for the next CBUNA conference. That would be something to watch for as you look for the next conference updates from CBUNA, if that's something that they'll be able to do at that time. We always wish we could be a part of it. We wish we could put those on and talk about them, but we have to maintain the confidentiality of the specific topics, even though we want to tell you, here are the general concepts that you should be familiar with. But we also try and reassure people. If you've been working for a couple of years in urology, you know so much more than you think you do, and you will probably do great. So, rely on your knowledge, rely on your day-to-day practice, rely on that hard work that you put in every day. It may not be something that's definable in an exact textbook to say, here's what I do every day in practice, but think of all of the things you come in contact with and how much you really know. And it's so much more than we think. So I try and reassure people. It can feel a little bit intimidating sometimes to study for an exam or to prep for an exam. And what do we study for? We're just wanting to see, do you have kind of the basics for what we would expect a couple years into practice? And if you are thinking about certification, you probably do. So, believe in yourself and your knowledge base and the great care that you're giving.
So an interesting fact, I did get an email from somebody thanking me for UroNurse, because she stated that she went and used the audio podcasts that are available. Every episode has an audio podcast, and on her way to work, she would listen to the podcast in her car and did that as a prep for the test, and she passed. So telling you, you heard it here first. Listen to
How did I forget to plug you and the podcast that we're on right now? I mean, this is a great place to get information. So please do use this as a source as well. This is great.
Yeah.
I wanted to welcome Tavo. I think I'm pronouncing that right. Very new to urology, 1 month, but hope to be certified in the near future.
Ah, welcome.
Good for you.
If you're
Tavo, how did you find out about UroNurse? I'm interested. If you could put that information in here, that'd be interesting.
One thing I wanted to share, that my experience of studying for the exam, it could be a little intimidating to see the guide because there's so much in there. But if you have somebody that wants to do it with you, or you have a group of people that wants to do it, it's so much better being in a group studying and throwing questions off to each other. It's for me, I didn't have anybody necessarily, but I did have people that were certified that would kind of drill me with questions and things like that. So that helps a lot as well.
I think Anthony's point too, just rely on what you've learned. If you've been in urology for a number of years, just think what you would do. And whatever you do, don't go back and try to rethink the question. It's the worst thing you can do.
Right. Go with your gut. Go with your first gut.
Go with your gut. And we're not trying to trick you with these questions. We want to say what's accurate current clinical practice. We're not trying to trick you. There's not trick questions. If you go with your gut, don't go back and double check things. You go back to those regular test taking things that you do. But I think to study as a group or is a great idea, because then also you learn from other people, and everybody does. We know that everyone does slightly different work in their day-to-day practice. So it can sometimes be hard to say, how do you test knowledge when everyone does slightly differently, or if you work in a subspecialty in urology. And we want to make sure that if you're working in urology, you have the basics of a general urology practice knowledge for a couple of years in. And to hear from what other people are doing, I think is helpful also. Not only does it make it a little bit more fun, but also then you get from other people's practice what they're doing, if that's something that maybe you're not doing regularly.
Yeah, good point.
So Tabo, now you've patiently waited his answer. So through Google.
There you go.
He found UroNurse through Google.
That's great.
Well, hope you'll be a steady follower for us.
And then Fran said she taped the study questions and would listen to the information to and from work.
Wow.
Yeah,
good idea.
I think it's a great way to study, just to kind of utilize that commute. I have a 1 hour commute each way to work, so it's plenty of time to listen to stuff.
You'll be an expert on everything in that commute.
It is a great way to learn. Well, this has been a great discussion. I had one quick question about the computerized test.
Yes.
So you have to get a score of 70. So if you got 70%, does it stop the test and say, hey, you passed, or do you have to take all the questions?
You go through and take all the questions. Part of that being with each iteration of the exam, as we're writing new test questions, just as kind of like the background that I had no idea about, that I learned just being on the board. As you write test questions and you're introducing them, some of those initial test questions, we consider them experimental, because if it's a new question that we've written as a board, we don't know really how it's performed yet amongst the people taking the test. And in the process of validating it, you put out a question, you see how it does, how people do. We validate that against the information that we have. We use statistics that thankfully we don't have to do specifically ourselves. The CNET works with us to do the statistical analysis. That was never my forte in nursing school, but to help to understand and make sure that these questions are accurate and not too difficult, not too easy. And so we want to make sure that you do all of the questions so that we can test the experimental ones also. So you go through the whole test. By the end, you get the score. And then that helps us in terms of saying, are these experimental ones good ones to continue, or do we have to edit them again? So, we're constantly editing and updating to try and make it as up-to-date, accurate, and appropriate of a test as possible.
And the people that are producing these questions are certified nurses that have taken the exam. And I know I was part of a group that wrote some of the questions that are in the test. I had all the easy ones.
Way back in the day, we had to wait. Like, how long did it take you, Vic, to get your results?
Oh, yeah.
6 weeks, whatever. How long does it take now?
Now you should get the result right away. Now, sometimes if there's testing center issues, maybe it gets delayed by a couple of hours, or you're finding out later that day, but you should be getting a result right away, which is much better than having to wait weeks to get an answer. The anxiety that happens, and so we tried to make it much more updated and an easier process if possible.
Good. There is some good with technology.
Yeah, sometimes.
That wait is terrible. You're like, did I pass? Did I not pass?
It's awful.
There's a lot of the anxiety for sure.
Yeah.
I did the same thing when you did your boards. I remember in at least the state of Illinois, people went by the weight of the envelope, because I guess if you passed, it was thinner than if you failed. I don't know. I never got
Oh,
the failed one, but it was always that anxiety of getting that envelope and then having to open it. And so now you
We
just
try and minimize that now.
I think that the nursing test, I was told, actually, once you hit enough to pass it, it shuts off. You don't have to do it.
Oh, wow.
That's what I was told.
Oh, you mean like the RN, just the regular?
Yeah, the RN.
Yeah, that's how I took it. It was up to, you can go from, I think it was 75 to 300 in some questions or something crazy. And, mine shut off at 75. And here I'm like, all right, I did really good, or
You're so bad it just
shuts
you
terrible. That was more awful. I would have rather had like 150, 200 questions.
Yeah,
that was crazy.
Well, this has been a great discussion. I'm going to bring in a little plug for next week's talk.
A single Botox treatment can be delivered with rigid.
Botox, also known as botulinum toxin type A, is commonly used as a treatment for overactive bladder. When injected into the bladder muscle, Botox works by blocking the nerve signals that trigger the muscle to contract. This results in a reduction of involuntary bladder contractions and can lead to decreased urgency and frequency of urination. Many patients experience significant relief from symptoms, which can last for several months. The procedure is usually done on an outpatient basis and involves injecting Botox directly into the bladder using a cystoscope. Join us next week to learn more at UroNurse.com.
Yeah, join us next week to learn more about Botox, see tips and tricks. I'm going to be talking about that. I've been involved with Botox when it was still experimental as part of that group that was doing the testing for that. So it'll be interesting. Should be interesting. Actually, and it's also going to be a remote one. So I'll be coming to you from South Carolina next week. Part of my travels of trying to see all 50 states. So we'll see how that goes. Hopefully I'm wishing for good internet connections, but thanks again, Anthony, for all your presentation information. I think it was really great. I think it's probably going to make a lot of people want to go ahead and take the plunge and become certified. And that's what we really like to see. Lori, it's always a pleasure to have you on board, and we'll see those of you that can join for Botox next week. Have a great week. And
thanks, Anthony. That was great.